好的，谢谢。非常感谢艾利克斯先生的盛情邀请，也非常荣幸的与李青博士、施恩谢教授和王光义老师探讨这个我们共同感兴趣的问题。这个我跟
I'd like to talk with you about the questions we are all interested in. I'm very familiar with Dr. Li Qing and Dr. Wang Guangyu. I took the responsibility of the career-related issue. So I also have acknowledgement with Dr. Wang Shengqin. As for today's theme, casting a vision, the future of forest therapy, I think it is a very broad theme. So I haven't prepared any PowerPoints. And I don't want to talk about any technical problems. In my perspective, I'd like to share my own point of views. Generally speaking, I think the forest therapy belongs to the whole human being instead of any country or individuals, because that is the demand of every individual. We have a Chinese saying goes, the thing of everybody needs to be done by everybody. We need a concerted effort. In the future, the forest therapy needs the sense of achievement of everybody. So we should focus on how can we deliver the sense of achievement to everybody. In the future, the forest therapy is relevant to the current situation of forest therapy. They have close connections. So in my own perspective, currently, the forest therapy around the world is that currently, no matter which country you are in, no matter which government you have, everybody loves and pay attention to it because it have close connection with the every individual and people's welfare. However, due to different philosophies, different modes, different culture, different policies, economic situation, and so on, there are huge or small gaps. What's more, currently, no matter in the academic or area or people-to-people exchange, there are not much cooperation in the research area. Most of the cooperation lies between people, but research institutes only make judgment depend on themselves, so there are some overlappings. Besides, there are also a lot of areas for development. So I think if we want to build a forest therapy system that brings benefits to everybody, the international community need to reach a consensus, which is we need a shared goal. I have 10 characters in Chinese, which is learn, shared, both a shared contribution and win-win cooperation. I have some immature feelings and opinions, so I want everybody can discuss it with me. I think it should have some features. First of all, in the future, it needs to be more cooperative. The first cooperation is the mind cooperation. Everybody needs to know its effect and meaning so that people can take active part in it. Secondly, it's the cooperation of behavior and integration. of different ethnic groups, different countries, so that we can learn from each other. We can leverage the advantage and get rid of the disadvantage. This is a good method if it's proved by practice. And we can thus find a way that is most suitable to the local region. And third is the integration of the related field. For example, the food, education, the elderly care, and so on, every part of people's life. It is relevant to the forest therapy. Although we have differences between different countries, for the global community, I think we need to reach consensus, although we bear some differences. Secondly, I think in future, the forest therapy needs more experts. There are different factors that can lead to the health differences, no matter it's man-made or natural, or so on. There are different factors. So we need specialization and research so that the community and the public can truly understand and trust us. So the basic research should be our foundation, but that needs a lot of talent, money, time, and policy support. So this is a systematic project. We cannot reach this goal in a very short time, regardless of the country or institute. We need concerted efforts so that we can reach win-win situation. What's more, about the regions to carry out forest therapy, the experts and the feedbacks, all of them need specialization. Thirdly, I think in future, the forest therapy needs to be more scientific. As for the psychological research, China has cooperation with different countries to conduct experiments to prove that forests have some benefits to people's health. Future, with the development of technology, maybe one day the forest and its environment can directly prove that it brings value to improve people's health. As for the mind and mental health, there are different factors. Man-made factors are the prime ones. In the future, we need the quantitative standards. So this is our expectation towards the future of forest therapy. Fourth, I think it needs to be more socialized. Currently, people who take part in forest therapy are experts, those who are in need or have better understandings. We call it people with money and time and good minds. However, the most important role of forest therapy is the prevention of the diseases, so that people can have less diseases and prolong the time they enjoy health. The largest feature of forest therapy is the natural therapy, which means it has no side effects and does no harm to human beings. People can enjoy their lives while improving their health and their welfare. This is the demand of everybody. So I think it needs to be more socialized. Its beneficiaries shouldn't be the minority of people. Instead, it should be the majority of people. Fifth, I think in the future, it needs to be more diversified. Based on scientific and expertise improvement, it should provide more diversified content so that everybody can enjoy the contribution of forest therapy, including healthy people. For example, they can take forest bathing. We also call it a jointly enjoyed and contribution system so that people can stay the healthy status. And for those who are unhealthy, they can try and experience the forest therapy. So they can be led and guided by the expertise and instructors to restore their health and experience the forest therapy. And for those who have already got symptoms, for those people, we should take professional prescription. We work with the medical institutions or experts under the guide of them. We can deal with their symptoms. Sixth, I think in the future, the forest therapy needs to be more globalized. Currently around the globe, the standard, the philosophy, the model bears a lot of differences. There are huge gaps. Different countries, different institutes, different organizations, based on their own understanding and based on their own resources or policies, they are doing their own business. In order to have our forest therapy quickly developed and be fully recognized, we hope that it can meet the demands of different cultures, different ethnic groups, different nations, different policies, different habits, different economies. And form a relatively unified philosophy, standard, model, and so on. So we really hope that this day will come as soon as possible. And that is my own understanding of the future vision of forest therapy. Thank you very much.